Hi everyone, Tanya Wills, midwife in New York City, and welcome to the Cancer Project, where I share with you my journey fighting stage 2 breast cancer. Today on the Cancer Project, I'm going to share with you about my trip to the radiation oncologist. So, I was so excited because at the same visit that I had my 4th AC treatment, just when I was like in the lowest of the low and feeling so crappy. I mean, this is the visit where I went in, they were like, last AC. And I started to cry and they were like, have you spoken to the social worker? I was just falling apart. They also said before I left that my oncologist wanted me to set up an appointment with the radiation oncologist. And it was at that moment that I thought in my head, oh my God, she thinks that I'm going to make it through this. She thinks that I'm going to make it to radiation, which was like amazing because AC, I don't need to recap for you, had some dark moments. So I was very excited to make this appointment and actually see what it might be like to be done with chemo. First thing that happened to me is I went to the building where the radiation oncology was going to be. I went in, I asked them what floor. They told me, I feel like it was the 2nd floor or the 3rd floor. I got into the elevator. There was a woman in the elevator with me and she must have been 60 or 65 years old. I mean, older than me, but not elderly by any means. And the doors closed in the elevator and she looked right at me, just me and her in the elevator, and she said, how old are you? And I said, I just turned 45. And she went, what kind of cancer? And I said, breast cancer. And she went, and then the doors opened. And I walked off the elevator, and in all the time that I've been, I was so worried about, losing my anonymity. And really, in New York City, I walk around with a head covering on my head, with a headscarf all the time. And, people walk around New York City with their heads covered for all sorts of reasons, for religious reasons, or just because they like the way that it looks, or, any kind of reason. And nobody ever looks at me. Nobody notices me. They just walk on by. I mean, this is New York. Nobody has time to care what you're dressed like, what you look like. It's just a beautiful, beautiful thing. Like the amount of acceptance that people have here in this town for just whatever it is that you have going on. It's just totally fine with people, which is something that I really love and has made me feel really comfortable going through this whole process of losing my hair and, wearing headscarves and all of this. This was the first time that anybody ever singled me out and knew that I had cancer. And it happened right in a building where they treat cancer. So that was a first for me. I knew that I wasn't in the breast cancer building. The next thing that happened was that I went into the waiting room. The waiting room was totally empty, save for one family that was there waiting, and it was clearly a mom and a dad, and the cancer patient was the kid. Whoa, there's a kid in here. And I think this kid was probably 8 or 10 years old, probably the same age as my kids. And he was bald and he had a mask on his face. And he was sitting in a wheelchair. Definitely looked like a kid cancer patient like that you would see on TV. And his parents were on the phone to some doctors explaining about they said, oh yeah, he had a blister and it broke, and talking about all these symptoms that he was having, all these problems he was having. But I looked over at the kid and the kid was just like looking down, playing on his Nintendo Switch. So I thought, okay, well, there's something, it's okay on some level. But it was very moving to me because it really took me aback. I've been in that breast cancer building and super focused on my own stuff and my own healing and my own emotional journey. And it never occurred to me that there are people my age that are going through this journey, except it's their kid that is the one that has cancer. And it really made me go, man, Tanya, stop feeling sorry for yourself. The only thing worse than me going through this myself would be one of my kids going through it. I don't know how I would do that. I mean, I guess I didn't know how I would do this. I mean, I guess people are amazing and they find a way, don't they? Things you learn on your cancer journey. So they called me back for my appointment, and the first person who came in to see me was a resident who's working in radiation oncology. It was a man, but we mostly sat in the chair, and he went through very, very thoroughly my entire history, getting everything straight, seeing how strong estrogen-positive cancer my cancer was. Everything. Basically, he sort of pointed out, a lot of the high risk things that came with my cancer, which was that, I had a positive lymph node and that I had lymphovascular invasion. And he said, but it's totally curable, totally curable. We're going to go for the cure. We're going to have aggressive treatments, and we're going to try to cure you. And it's curable. It's curable. And I was like, well, that's really good to hear. He says, you're 45. You have a lot of life to live. So we're just going to go for it. So I was like, great. One of the things that he mentioned to me was that one of the risks of radiation is that it can actually damage your heart, and that they have a way of protecting your heart and lungs. And it has to do with you holding your breath while they give you the radiation, that apparently that the lungs, or I don't exactly know how it works, but it protects your heart from the radiation. So he said that because my cancer is on the left side, and that's where, all that is, that I'll be doing that when I do my radiation. And I know that some people skip radiation because they're nervous about the damage that it could do to their heart. I am not nervous about it. It's a very, very small percentage, and I definitely want to go for a cure for my cancer. So I'm super committed to doing everything that we know is possible. I did a lot of reading about radiation, and I know when combined with lumpectomy, radiation plus lumpectomy is just as effective as mastectomy, and some studies show that it's actually better, that there's actually longer overall survival if you go this route. So that was really, really great. He did mention that I will probably experience some burning and peeling of the skin, and that the other major side effect to radiation therapy is fatigue. But I kind of was like, I just made it through AC chemo, and you're going to talk to me about fatigue? Is it worse than that? I will let you know. So we'll see. I'm going to be going through radiation this summer, so I'll tell you more about it. My meeting with the resident was actually really, really terrific. I really liked his way. He did give me a breast exam. I felt totally comfortable about it. And it was actually a very thorough exam. It was not a bullshit exam. So that felt really, really nice. He spent a solid half an hour going through my history, doing the exam, getting to know me, and it was a really, really positive experience. And then he said, okay, I'm going to go out and get Dr. McCormick, so I'll be right back. So I waited a few minutes, and then I thought that he would come back in with Dr. McCormick, but he didn't. It was just Dr. McCormick. So my radiation oncologist, yet again, my medical oncologist came through for me, and she recommended and referred me to the best person that they have at Sloan Kettering. So I'm seeing the chief of radiation oncology. That is my radiation oncologist, and she's been practicing since the year I was born. So I sort of felt really, really confident in her hands. But I was a little bit nervous. I thought, oh, what's her bedside manner going to be like? And she was great. She came in, she sat down, nice to meet you, and she said, so tell me, how do you become a midwife? And I told her about how I became a midwife and how I got into it and how much I love it. And I explained to her how I haven't been able to catch babies so much, but I'm really looking forward to getting back to that after my treatment is over. And that this visit at the radiation oncology was the first visit that I had where I started to really think, man, they think I'm going to make it through chemo. They think I'm going to make it. I talked with Dr. McCormick, and she also did a breast exam. She took a look at what was happening with my lumpectomy healing, and she looked at my records, and she said, I know your whole story, I know all about it. Everything was going to kind of depend on whether I wound up with a lumpectomy or a mastectomy. She said that there's not as good of data on how much radiation you need after a mastectomy, and that the only studies that they have really don't apply to my case, so it would be hard to know what to do. She said, actually, if you wind up with a lumpectomy, we have tons of research on that. And she said, you'll actually wind up with less radiation if you have the lumpectomies. I should expect 4 weeks of radiation. It's 5 days a week. You come in, they kind of get you set up, and then the radiation actually takes about 5 minutes. My radiation is going to be whole breast radiation, and since I had one positive lymph node, they're also going to irradiate under my arm, and they're also going to irradiate your supraclavicular and infraclavicular lymph nodes. Those are the lymph nodes near your collarbone. I have no signs of cancer in those lymph nodes. I think also the ones by my breastbone, but they just kind of irradiate the whole area, and it gives you extra protection. If this is interesting to you, what they used to do if somebody had a mastectomy or a lumpectomy, they would do what's called a total axillary lymph node clearance, where they would just remove, all of someone's lymph nodes, or like 22 lymph nodes or 30 lymph nodes, or this kind of thing. And what would happen is that all of those lymph nodes that you have under your arm are really important because they help your arm to like drain lymphatic fluid and fight infection and all these kinds of things. So people would get what's called lymphedema, which is like, maybe you've seen it when somebody's arm is very, very swollen because they've had their lymph nodes removed. And what can happen, it's very painful. People wear compression sleeves, and their skin can actually get really stretched and really hard and really oozy, and it's really, really uncomfortable. What they've sort of learned now is that less is actually more. And if you're going to be getting radiation, they actually found in a study, Dr. McCormick explained this to me, it's like another way that they do things at MSK, which is they just explain the study right to the patient and they tell you what the study is. So she said it's called the Z11 study, which I went and looked up after my visit. She said that what they found was that irradiating the axillary lymph node area was actually just as effective, if not more effective, and then taking out all the lymph nodes. And they also found out that, of course, it really lowers the risk of the patient getting lymphedema. I am totally on board with that. I've been really lucky. I know a lot of people have breast surgery and they have lymph node surgery and they have all kinds of range of motion problems, but I haven't had any healing problems. I haven't had any range of motion problems. So I feel really, really lucky. So that's our plan, is that hopefully the lumpectomy will be enough. This summer, I'll have 4 weeks of radiation. She spent easily a whole nother 30 minutes with me discussing all of these things and educating me about radiation. So it was a really, really positive experience. I thought I was going to be there for like 5 or 10 minutes and they'd be like, yeah, we'll irradiate you and that'll be it. But it was actually really, really in-depth. Yet another excellent experience at Memorial Sloan Kettering. So I'm really, really excited. I know she's been in touch with my surgeon and she's been in touch with my medical oncologist, and the three of them are working together really, really closely as a team. Incredible women taking care of me. I'm really excited about it. In another video, I will tell you more about my newest chemo adventure, which is Taxol, and lots of other things to share with you about sort of the second half of my chemo journey. So we're moving along here and I'm feeling super optimistic today. So if you like my shit, subscribe and like and set yourself up for some alerts. That way you know when I have a new video coming out. Please share and I'll see you next time. Bye.